Well, hey guys, thanks for tuning in. The topic of today's video is going to be about how to properly take your levothyroxine. It's a question that I frequently get asked in clinic and can be a source of fluctuating TSH levels and difficulty in establishing one's correct levothyroxine dose. The good news is that it's pretty easy to fix once you understand the principles of levothyroxine absorption and metabolism, which I'm going to share with you in this video. So stay tuned, and we're going to talk about a few tips that I have on how to, on best practices of how to take your medication and how to keep your thyroid levels in balance. Levothyroxine on an empty stomach. Taking medication, levothyroxine medication with food can reduce the absorption of your levothyroxine. There was a study that compared taking levothyroxine with food to taking it with water by itself, and the absorption was demonstrated at 64% when it was taken with food compared to 80% whenever it was taken by itself with water, which is a reduction of negative 16%. That's a significant amount. Some case reports have also demonstrated foods higher in fiber and soy can be a little bit more problematic than other foods. Nonetheless, you're going to want to take it completely by itself without any food. But if you're eating foods high in fiber or with soy for your breakfast, an hour after you take your levothyroxine, you may just want to try to be consistent about the frequency and amounts of those foods that you're eating for your breakfast. Also, you'll definitely want to avoid taking your fiber supplements if you are taking a fiber supplement at breakfast, and maybe move those to lunch or dinner time so that you don't have high amounts of fiber in proximity to your levothyroxine dose. Also, gastric acid or an acidic pH in the stomach also occurs during fasting conditions, which appears to be important for subsequent absorption of levothyroxine in the intestine, where it's absorbed in the jejunum and ileum. For this reason, if you're taking chronically taking proton pump inhibitors, that can reduce your body's ability to absorb levothyroxine. These medications would include ones like Lansoprazole, Esomeprazole, or Pantoprazole. If you do happen to be prescribed one of these medications, don't stop taking it, but definitely let your endocrinologist know that you are on one, because they may want to monitor you more frequently when they're started, so that they can make adjustments to your medications and monitor you appropriately. Tip number 2, timing is everything. You need to take your levothyroxine either in the fasting state before breakfast and then wait 60 minutes before eating breakfast, or take it right before bed at least 3 hours from your last meal or from the last time that you ate. Because co-administration with food, like we just talked about, and levothyroxine can impair levothyroxine absorption, it's important for you to take your levothyroxine not too close to meals and snacks, so that way that you can absorb your medication to the max. There have been several studies comparing different timings and like which one is the best, and percentage absorption at different times and things like that. In order of best to worst, when we're talking about efficiency of absorption, is 60 minutes before you eat breakfast. That's the best. The second best is right before bed, at least 3 hours after your supper. The third best is 30 minutes before breakfast. And then the absolute worst is to eat breakfast at the same time that you take your levothyroxine. The fasting regimen, the first one that I mentioned, taking it 60 minutes before you eat, also has an additional advantage of more consistent TSH levels compared to the bedtime regimen. Although this really has to be tailored to the individual. For some people, it's really, really hard to take it first thing in the morning. And so then it may be better to take it right before bed. So talk to your doctor, and you guys can tailor together the best way for you to do it. Tip number 3, take your pill with water, and with water only. For all my fellow coffee lovers, it totally pains me to say this, but taking your levothyroxine with coffee should ideally be avoided. So this has been studied and looked at, And in those investigations, they showed that, or what was demonstrated was that taking levothyroxine with espresso coffee showed a reduced maximal concentration of levothyroxine levels in the serum or in the blood compared to whenever people took it with water. Thus, it does appear that espresso coffee acts to sequester levothyroxine and decreases its absorption. So if you want to be really tailoring your thyroid hormone levels, you want to take it just with water and then wait that 60 minutes before breakfast. Also, you don't want to try to take your levothyroxine without any liquids, because if the pill gets slightly kind of like absorbed or dissolves into your mouth or in the throat, then less of the medication is going to get absorbed into the bloodstream. So definitely take it with water, wait 60 minutes, and then eat breakfast. Tip number 4, take levothyroxine separately from other medications or supplements. Medicines similar to foods can bind levothyroxine and inhibit its absorption. For the most part, you can space most medications by 1 hour from your thyroid hormone, but there are certain ones that are a little bit more problematic than others and need to be spaced by a minimum of 4 hours from your thyroid tablet. These would include calcium-containing supplements or medications, or iron. Those ones, like I said, need to be spaced by 4 hours. They are kind of the biggest kind of problems. In a study comparing taking levothyroxine with ferrous sulfate, which is iron, or taking levothyroxine just with water, the TSH, when taking it with water, started at 1.6, and then when they added taking it with iron, it went all the way up to 5.4. That's a pretty significant increase whenever we're talking about TSH levels. And those of you who are who kind of pay attention to your levels, I think you would understand that. Then remember that the higher the TSH level, it means the less the levothyroxine that you're getting, or the more hypothyroid you're getting as the TSH goes up for people with primary hypothyroidism. Also in this category of like problematic medications include bile acid sequestrants such as Cholestyramine and Colesevelam, phosphate binders like Sevelamer, calcium and aluminum containing antacids like Malox or Tums, Rolaids, and Sucralfate. If you I'll put a list of these medications together and list them down at the bottom for anybody who wants to take a look at those that you might be interested. Tip number 5, use a pill box. For many people, it can be easy to lose track of whether or not you took your pill that day. And your medicine doesn't work if it's still in the bottle. So you want to make sure that you're getting every single pill in during the week. You might think that one missed dose isn't really that consequential or that big of a deal, but if you think about it, for example, if you're prescribed 100 micrograms of levothyroxine every day, that amounts to 700 micrograms per week. Well, if you miss one dose, then you've really only gotten in 600 micrograms in the whole week. If you divide that out and average it out by 7 days, then you're really averaging only 85 micrograms per day. That's like as if you had dropped an entire dose step down. And if you miss 2 times during the week, then you only got in 500 micrograms in the week, and that drops you down to about 71 micrograms on average per day. So, which is like a 30% decrease in your total levothyroxine amounts. That's a lot. So definitely make sure that that you have a system, whether it be a pill box or a calendar or something else, to make sure that you are getting in every pill every day. Tip number 6, if you do happen to miss a dose, the next day take 2. In the euthyroid state, the half-life of levothyroxine is about 6 to 7 days. As far as medications are concerned, that's actually quite a long time. What that means is that it takes about a week for your body to reduce the concentration of the active form of levothyroxine of one tablet to about half. So that also means that the medication that you take any one day stays in your bloodstream a really long time. So as long as you make up your medication and if you miss a dose and you take another one, then make it up and take it the next day by taking 2 pills, then everything's going to kind of even out in the long run. Tip number 7, Take your pill at the same time every day. Making it part of your daily routine will make it more likely that you will take your pill, that you'll remember. And also standardizing the time of day that you take it is going to minimize other things, other variables that can affect the absorption of your levothyroxine and therefore your thyroid hormone levels. And my last and final tip, number 8, is to store your pills in a place where you will remember to take them. A typical place I like to recommend that people put their levothyroxine bottle is right next to the bedside in the bedstand with a bottle of water or a glass of water that you put there the night before. That way, as soon as your alarm clock goes off, even before your feet hit the floor, you take your levothyroxine and the clock starts ticking for you to have that space and time before so that you can have your breakfast and your coffee and all that good stuff. Another good place to put them, or that a lot of people like to do, is right next to their toothbrush, because most of us will never forget to brush our teeth every morning, and so that kind of pairs that habit so that you won't forget that. Remember to keep your levothyroxine pills dry and always make sure that they are out of the reach of children. That wraps up my tips on how to properly take thyroxine tablets. I hope this video was helpful. If it was, click like below and subscribe. I'm Dr. V, Endocrinology, helping you with all your hormone questions and to find your perfect balance. Please leave comments below on any topics that you'd like for me to cover in the future, and hasta luego.